Hi, Dr. Neal. My name is Leslie. I live in Miami, Florida, and I am 31 years old. I have been suffering from acne since I was about 15. Now, the acne that I had when I was a teenager was actually not terrible. I was able to control it more or less with some over-the-counter products and some Proactive. But by the time I got into my late teens, it was obvious I needed to start seeing dermatologists and getting something that was stronger for my acne because it was actually getting worse. I think over the years, I've pretty much seen somewhere between 10 and 12 dermatologists for this condition, and none of them really ever did anything that would significantly help my acne. I think they all helped a little. But really, I also don't feel like any dermatologist I've ever seen really has a grasp on this condition, period. It's a very trial and error and let's throw everything at the wall and see what sticks kind of routine. So of course, at first they put me on the usual, let's try the Retin A and let's try the different gel. And that was actually terrible because I would just get all red and flaky. And so not only did I have acne, but now I have acne that I can't put makeup on top of because makeup does not sit very well on top of flaky skin. So that lasted, I want to say 6 months to a year before I said, this is totally useless. We need to move on to something else. By then, we were moving on to things like blue light therapy and, of course, the monthly facials, the chemical peels, the microdermabrasion, and we were trying to give it time to see if any of that would really help the acne. At that point, I also tried something very painful. It was a laser treatment, and it was supposed to zap the glands that make the oil in my face. I think now they're calling it smooth beam laser. It hurt like hell, and it did help a little bit, but it certainly wasn't worth the cost, the amount of downtime that I had after it because my face would swell up, and it just really wasn't worth it in the end. I never got to a point where my acne was actually totally inactivated, in your terms. So at that point, the dermatologist, the several that I had seen, basically said, look, we're going to have to move on to the 3 things I know you didn't want to do because I had made that clear from the beginning. I didn't want to do any oral contraceptives, any oral antibiotics, or any Accutane. They had actually given me topical antibiotic, which did seem to help a little bit. But again, at the end of the day, it just didn't stop the acne. By this time, I was about 25, 26 years old, and the scarring was starting to get much worse. Like with every cystic bump that would sit on my face for 2 months, even if I didn't touch it, it would just go away and leave a hole on the side of my face, and this was becoming very distressing. So I kind of gave up and said, okay, let's try one of the 3, the oral contraceptive. And voila, I got on Yaz. Within 2 months, my acne was totally gone, and I couldn't believe it. For 5 years, I was very happy, and I had no acne on my face. But I've always been very concerned about the effects of staying on oral contraceptives or any artificial hormone. I've never liked the idea of it. So January of this year, I decided I'm over 30. I'm going to stop taking these pills. Maybe my acne has gone away. Well, wow, I really underestimated my acne. It has not gone away. Within 3 months, I totally noticed my skin starting to change in texture. I had all of these mini bumps under my skin on both sides of my cheeks. By June, I had huge cystic flare-ups on the left side of my face. This became extremely embarrassing to me. Most people that I know, that I'm friends with, that I deal with on a daily basis, had never seen me with any type of acne on my skin. So everyone started to notice and ask me, what is wrong with your face? What's going on? Is that an allergic reaction? And of course, to me, I always knew I had this acne. So it should not even be this surprising that it came back with a vengeance. But I am a professional and I work directly with clients that I meet with. And the thought that they're staring at my face and they look over at my cheek, which is a total minefield of bumps, it's humiliating. It's distressing. I am becoming I'm to the point where I know that the makeup does not cover this level of acne. And really, I know the pictures don't look that terrible right now. We're in October. I want to make clear everything I do right now to control my acne to that point. Right now, I'm seeing another dermatologist. I'm on the Obagi 3-step system for acne, which burns like crazy. I get chemical peels once a month. I get facials once a month. I do microdermabrasion once a week. I use the blue light therapy on my face every other night. I actually bought the panel. It cost me $1,000. And I sit in front of it for half an hour every other night. I don't eat dairy. I don't eat sugar. I am on a ridiculous vitamin regimen, which seems to have helped a little bit. But it consists of swallowing more than 40 pills a day, including tons of vitamin A. It's 200,000 international units of vitamin A a day, which is already a whole lot of pills. And then I take 10 grams of vitamin B5, not milligrams, grams of vitamin B5. That in and of itself is 20 pills. Then I take zinc, omega-3, vitamin D, GLA, and bunch of other stuff that's supposed to help that. My stomach kills me every time I take a grouping of these pills. And as you can see, even after this very strict regimen, I still have acne on my face. I've also tried about 3 months back the plasma rich facial where they take the stem cells out of my blood and inject them back into my face. Somebody had told me that had helped their acne. So I thought, hey, let's give this a try. That definitely did not do anything for my acne. So as you can see, I still have plenty of bumps and acne on my face. And Dr. Neil, you are the first glimpse of hope that I have had all year since getting off of the birth control. And really, before finding your website, I pretty much had given up. And I thought, I'm going to have to go right back on this birth control because I cannot continue to do this much damage to my skin and have these pock marks and 3D marks and bumps. And when the pimples come, it's 3 or 4 at a time where the makeup can't cover it. I can't continue to deal with this. So I thought I was just going to have to go right back on the birth control. And I really didn't want to do that. So I'm very happy that I found your site. The work you have done is absolutely amazing. I don't see how anybody can say that any of those videos are fake or photoshopped, or the level of detail, the clarity of the pores in your patients is something that I have never experienced since the time I was 15 years old. So I can't wait to get started on your boot camp. And I really want to thank you for your dedication. Really, you will be the first dermatologist that I think even has the slightest handle on this condition. Thank you very much.